The interview was being conducted on the steps of the Santiago Bernabéu Stadium on a bright Wednesday afternoon in May, a routine promotional session for Ronaldo's upcoming charity match that was expected to last 15 minutes and cover the usual topics about giving back to the community and using football to bring people together. But what started as standard media obligations transformed into something far more significant when an elderly man collapsed just 20 meters away from where cameras were rolling and reporters were asking predictable questions about goals and dreams and the responsibility that comes with being a role model for millions of children around the world. Eduardo Martinez was 73 years old and had been walking past the stadium on his way to visit his grandson who worked at a nearby cafe, his daily routine that had remained unchanged for 5 years since his retirement from the postal service. But this particular afternoon, his heart began to fail him in the way that hearts sometimes do when they have been working faithfully for 7 decades and suddenly encounter a blockage that transforms a normal day into a medical emergency that requires immediate intervention to prevent what could easily become a tragedy witnessed by thousands of tourists and passers-by who might watch helplessly as someone's grandfather dies on a sidewalk while emergency services navigate Madrid traffic that could delay their arrival beyond the critical window, when CPR and basic first aid can mean the difference between life and death. The first sign that something was wrong came when Eduardo stumbled and caught himself against a lamppost, his face going pale as he pressed his hand to his chest and looked around with the confused expression of someone who understands that their body is betraying them but doesn't know what to do about it. And several tourists noticed his distress, but hesitated to approach because language barriers and uncertainty about how to help made them reluctant to get involved in a situation that clearly required medical expertise they didn't possess, leaving Eduardo isolated in his crisis, despite being surrounded by people who wanted to help but didn't know how to provide assistance that would be useful rather than potentially harmful. Ronaldo was in the middle of answering a question about the importance of youth football programs when he noticed movement in his peripheral vision, the kind of urgent, uncoordinated motion that signals distress rather than normal pedestrian activity. And when he turned to look more closely, he immediately recognized the signs of a medical emergency unfolding just meters away from where he was conducting an interview that suddenly seemed trivial compared to the human drama that was developing in real time. And without finishing his sentence or excusing himself from the cameras, he broke away from the interview and ran toward Eduardo, who was now sliding down the lamppost toward the sidewalk as his legs gave out and his breathing became labored and irregular. "Call an ambulance immediately," Ronaldo shouted to his security team as he knelt beside Eduardo, his years of athletic training having included basic first aid certification that he had never expected to use in circumstances like these. But as he checked Eduardo's pulse and breathing, he realized that the elderly man was experiencing a massive heart attack that required immediate intervention, rather than waiting for paramedics who might not arrive in time to save someone whose life was measured in minutes rather than the hours that emergency response time sometimes required in busy urban environments, where traffic and distance could delay help beyond the point where it would be effective. The crowd that gathered around them included several people with medical training, including a nurse who had been touring the stadium and a retired doctor who happened to be walking past when Eduardo collapsed. And together, they formed an impromptu medical team, with Ronaldo serving as the primary coordinator and physical support, while the medical professionals provided expertise about CPR techniques and heart attack protocols. But what made their collaboration effective was not just their combined knowledge, but Ronaldo's natural leadership ability and his refusal to be a passive bystander when someone's life was in immediate danger, regardless of whether cameras were recording his actions or whether his intervention would generate positive publicity for his charitable work. Eduardo's condition deteriorated rapidly, his breathing becoming shallow and irregular as his heart struggled to pump blood effectively. And when he lost consciousness completely, the medical professionals began CPR, while Ronaldo held his head steady and spoke to him in Spanish, telling him to hang on, that help was coming, that his family needed him to fight through this crisis. And though Eduardo couldn't respond, his eyelids fluttered occasionally, as if he was aware on some level that people were working to save his life, and that he wasn't alone during what could have been his final moments if he had collapsed somewhere less visible or surrounded by people less willing to get involved in a stranger's medical emergency. The ambulance arrived 12 minutes after Ronaldo's security team called, which felt like hours to everyone involved in keeping Eduardo alive. And the paramedics were surprised to find that their patient had been receiving professional quality care from an unlikely medical team led by one of the world's most famous athletes who had abandoned his scheduled interview to provide life-saving assistance to someone he had never met before, but whose welfare had become his immediate priority. Once he recognized that intervention was needed to prevent a preventable death on a sidewalk outside the stadium, where he had scored hundreds of goals, but had never done anything more important than helping save Eduardo's life. The transfer to the ambulance was complicated by Eduardo's unstable condition and the crowd of onlookers who had gathered to watch the drama unfold. But Ronaldo used his authority and physical presence to create space for the paramedics to work, while simultaneously comforting Eduardo's grandson, who had arrived from the cafe after being called by witnesses who had found Eduardo's phone and contacted his emergency contacts. And the young man's tears and obvious distress made everyone present understand that this was not just a medical emergency, but a family crisis that could result in a grandfather never coming home to the people who loved him and depended on his presence in their daily lives. Ronaldo insisted on riding in the ambulance to the hospital, despite protests from his management team about schedule disruptions and the promotional interview that would need to be rescheduled. But he was unwilling to abandon Eduardo during the critical transport phase when his condition could worsen without warning, and when having familiar voices and reassuring presence might make psychological differences that could impact his recovery. And during the 15-minute ride to Hospital Universitario La Paz, he held Eduardo's hand and continued talking to him, sharing stories about his own grandfather and the importance of fighting through difficult moments, because families need their elders to survive and recover from health crises that seem overwhelming, but can be overcome with proper medical care and determination to live. The hours that followed in the hospital's emergency department were tense and uncertain, with Eduardo undergoing emergency surgery to clear the blockage in his coronary artery, while his family gathered in the waiting room where Ronaldo sat with them. Not as a celebrity making a public relations gesture, but as someone genuinely concerned about Eduardo's welfare and committed to supporting his family through a crisis that could have resulted in tragedy if not for the quick response and coordinated care that had begun on the sidewalk outside the stadium and continued through the ambulance transport to surgical intervention that ultimately saved his life. The surgery was successful, though Eduardo's recovery would be long and complicated, requiring months of cardiac rehabilitation and lifestyle changes that would challenge someone his age, but were preferable to the alternative of not surviving the heart attack that could easily have killed him. If he had collapsed in a less visible location, or if the people around him had been less willing to get involved in providing assistance that required them to abandon their own plans and priorities, in order to focus on saving a stranger's life through coordinated action that demonstrated how quickly a group of individuals could become an effective emergency response team when circumstances demanded immediate intervention. Eduardo regained consciousness 2 days after his surgery, his first words asking about the people who had helped him. And when his grandson explained that Cristiano Ronaldo had been one of the people who had saved his life, Eduardo's reaction was not starstruck excitement, but profound gratitude for someone who had chosen to help, rather than simply observing from a distance. And when Ronaldo visited the hospital the following week, their conversation focused not on football or fame, but on family, recovery, and the second chance that Eduardo had been given to spend more time with the people he loved, and to continue contributing to their lives in ways that money couldn't buy and fame couldn't provide. The media coverage of the incident focused initially on the dramatic footage of Ronaldo abandoning his interview to help a stranger, But the deeper story was about the human connections that had formed during those critical minutes when social status and celebrity meant nothing, compared to the fundamental human obligation to help someone whose life was in danger. And Eduardo's family sent letters to everyone who had participated in saving his life, thanking them not just for their medical assistance, but for treating their patriarch with dignity and care during his most vulnerable moments, when he needed strangers to become temporary family members who were willing to fight for his survival. 6 months later, Eduardo attended Ronaldo's charity match, not as a special guest or photo opportunity, but as someone whose presence reminded everyone present that the most important victories happen not on football pitches, but in moments when people choose to help each other during crises that test character and reveal what really matters. When life and death decisions must be made quickly and without concern for personal convenience or public recognition, proving that heroism exists not in athletic achievements, but in the willingness to abandon self-interest in order to serve others who need help that only we can provide at moments when our response determines whether someone lives or dies. The foundation that Eduardo's family established in honor of his second chance at life focused on public CPR training and emergency response education, with Ronaldo serving as a spokesperson who emphasized that medical emergencies happen without warning and that everyone should be prepared to provide basic life support when circumstances require immediate intervention to save lives. And their collaboration demonstrated that near-death experiences often create relationships and commitments that outlast the initial crisis and generate ongoing efforts to help other people who might face similar emergencies without the benefit of having trained responders nearby when every second counts. And when the difference between life and death of 10 depends on whether bystanders are willing and able to provide assistance that bridges the gap between collapse and professional medical care. Years later, when Eduardo celebrated his 80th birthday, surrounded by children and grandchildren whose presence in his life had been made possible by the intervention of strangers who had refused to be passive observers during his medical crisis, Ronaldo would reflect that stopping the interview had been one of the easiest decisions of his life, because it represented the kind of choice that revealed character rather than creating it. The choice between personal convenience and human obligation that everyone faces when confronted with opportunities to help others who cannot help themselves, and who depend on the kindness and courage of people who are willing to act when action is needed, regardless of personal cost or public recognition.